Generally, when a patient presents to us with headache, what comes to our mind? It could be migraine. And this is commonly the mistake which most of us do. So, what is this cervicogenic headache or cervicogenic migraine? Come, let's discuss about it. I am Dr. Wiquar, consultant pain specialist at Alleviate Bangalore. Cervicogenic headache is headache originating from your neck, and it actually radiates into the bones or the soft tissues around your neck and the occipital area. So in this, the patient usually have a single-sided headache which restricts the movement. So the patient comes with a tight neck, and it's very important for us to differentiate between other headaches like migraine or any other primary headache or any tension headache. So in this case, the history plays a very vital role, where we are actually asking the patient. Most of these patients, it's equal between male and female, and it ranges between 35 to 45 years. Usually, it's not very common, but yes, it's very important to differentiate in these cases. So once we have had this history in detail and we go for physical examination, most of the muscles around the neck are quite tight. And usually these headaches originate from the upper cervical areas or the cervical spine, like C1, C2 and C3. So there are also nerves which originate from here. So there is an overlap between the trigeminal nerve also, because all this go through a similar or the same pathway that is called as trigeminal cervical nucleus. So for that reason, pain originating from the neck can actually be conducted to the frontal or the temporal and also the facial areas, because this is supplied by the trigeminal nerve. So the patient says that the pain may radiate to these levels. Very, very commonly, it is originating from the facets or the joints which are there in the neck. So these joints, your C2, C3 joint, which is, there is a small nerve which is present above that also. So once we have actually diagnosed it and we are actually suspecting otherwise that it could be headache, we also can take help of other modalities like your MRI, your CT, but usually it is mainly for excluding many things, excluding any other probable diagnosis which actually could be there. Most of the times, when you suspect for cervicogenic migraine, you may have to place a small needle which also gives you the diagnosis. So this is called as a diagnostic injection. Once you have got that decent relief coming out of this diagnostic injections, it can be treated with trigger point injections and physical therapy. Sometimes with physical therapy alone, the patient may complain of slight more pain. So physical therapy also is started after a trigger point injection, where a local anesthetic can be placed under ultrasound guidance into those small thin muscles which are present in the neck and behind your head. Most of the time that overlap can also be dealt with, because the migraine also has got sensitivity. In this case, sensitivity to light and noise is not so much. There is also something called as an epidural injection at the cervical level, which is a cervical epidural injection given from the lower end of the cervical region, like C6, C7 area, where a small dose of steroid can be placed, because we should remember that the loop of pain which is there is always a sensitivity to pain in chronic pain conditions. This can be broken down because of the steroid injections. And you also have selective medial branch blocks, where these joints, the facet joints which are present, they are supplied by certain nerves which are called as medial branches, and these nerves can also be silenced. So these are all the spectrum of treatment which can be offered, but primarily evaluating and diagnosing and coming down to that diagnosis is very, very important. So any further queries, do call us, mail us, or even better, pay us a visit. Thank you so much.